Welcome to Because We Care for Young Homemakers Day, a weekly program filled with information on the art of homemaking. And now here's your host, Kimberly Ross.
Hello and welcome to Young Homemaker. Today's program is dedicated to expectant mothers. Having a baby today is different than it was 20 years ago. This is due to the advent of Lamaze and of new birth alternatives. Today we are going to find out just what these alternatives are and perhaps answer some concerns you may have about labor and birth. My guest today represents St. Anne's Hospital in Westerville. Jane Altman is an RN and Director of Education for Childbearing, and Amy Chafins is a labor and delivery nurse and is expecting twins in November. Welcome to the program. There has been a real reconstruction lately taking place in hospital maternity units all over the country. And as a result, women are being faced with making their own decisions on how to deliver their baby. Why the change?
I think the change has come about because we have more educated consumers. We have people who are watching television programs such as this across the country. Many people are reading the volumes of books that are being written about various options, and they want some of it for themselves.
This is good news for women who know about all the options and are educated in those, but those who aren't familiar with them, and a lot of this is for first-time mothers, it can be a little confusing, can it?
Certainly it can be. That there are those women who are not interested in childbirth classes, who maybe read and hear about it, but who just put their faith in their doctors and go to the hospital and deliver.
What's the solution?
To the various childbirth options, I certainly think reading and going to classes is most helpful for people when they're trying to decide what they want to do.
Now, are you saying a woman should not listen to her doctor or not follow what he says?
Oh, no, I certainly wouldn't say that. But there can be an informed discussion between the couples and the doctor about what they would like to have, and certainly many of the doctors are very open to what couples want to make that birth experience the happiest that they can have.
Let's talk about birth options. What are they? Could you describe briefly each of those that are available now?
I think one of the options that couples think of now and that they're looking for a lot is to labor and deliver and recover in the same room, the birth room concept. And that's more comfortable, more home-like. There are a number of people who would like to have home deliveries but like the convenience of the hospital and the safety of the hospital, and so they're looking to combine those things that they might have at home. Some people are looking to have their other children present at the birth. That's another option. There are many options in terms of medications and anesthetics that people are interested in. We've got one group who are looking to have maybe what they would call natural childbirth, where they're not going to have medications or anesthetics, and another group that would like to have whatever they need, and so they can think about being awake and being aware of what's going on and still decreasing the amount of discomfort that they're having with the labor and delivery.
Is the birthing room the most dramatic change, or are there others?
I think the most dramatic change in the last 10 or 15 years has been having the woman's partner, the father of the baby, whoever her support person is, her mother or sister, somebody with her during the labor and the birth as well. Now also we're seeing some siblings at birth, but that's not encompassing most of the births by any matter of means.
20 years ago you would find the father in the waiting room pacing. Now you find him right beside his wife helping with the delivery.
Right.
Why is his role changing?
His role is changing because some fathers felt that they were a part of the conception, they should be a part of the birth of their child, and it has just become more publicized, and we see a lot of fathers who are coming to classes who have heard from their friends or their relatives that they were present at the birth and what a great experience it was, and they don't want to miss that.
It sounds like it's something that's becoming very popular. Do you think this will be a passing fad?
I hope not. I hope not, for the mother's sake as well as for the father's.
Mm-hmm. There's a real difference involved emotionally, do you think?
We, in our childbirth education classes, have birth reports that couples fill out after their baby is born. And one of the comments that I see over and over again on the birth reports is from the mothers who say, I couldn't have done it without my partner's support. And they think that, maybe the breathing and the relaxation is the thing that's going to help them the most. But by and large, it's the support that they get during labor from their loved one that is most meaningful to them. And then the support people themselves who are just in awe of the whole experience, and you could hardly drag them away.
Amy, being a labor and delivery nurse and also being pregnant, you're sort of seeing things from both sides. What advice can you give expectant mothers about preparing themselves?
I think that the Lamaze or childbirth preparation classes are very important. I think it enables the woman not to just lie there in bed with her contractions and feeling helpless, but it gives her knowledge, and she knows what to expect, what to do with her contractions, how to relax, how to make the pain less, what options that she has available to her. Yeah, I think it's very important.
So Lamaze is the big word here.
Yeah, basically.
Let's talk about that. A lot of people have heard the term, but they may not know what it is. Can you explain what Lamaze is and how it works?
The term Lamaze is used loosely for a variety of different kinds of childbirth preparation classes. And we at St. Anne's call our classes labor and birth because they focus on Lamaze techniques as well as whatever is going to go on during labor and birth. We talk about medications and anesthetics that a woman might be exposed to, hospital procedures. And then we also deal with the Lamaze techniques. So we're basically looking at an education process as well as breathing and relaxation. The breathing and relaxation techniques are in a way like conditioned responses, so that a couple will learn the technique in class, practice it in class, and then practice at home how they are going to breathe and relax when the contraction begins. They do simulated practice sessions. And then when labor really starts and contractions are coming in earnest, they've done this over and over again so that they're immediately able to get into the technique when they need it.
Some people have referred to it as a mind over matter technique. Is that essentially what it is?
I think so. Lamaze is really a mind diversion technique. It's breathing that one would not normally do just as we are sitting here, so that the woman has something specific and something different to do, something that she really has to concentrate on to get her mind off the contraction.
So in other words, it lessens the pain of childbirth?
Definitely, and lessens is a good word because it's not going to take it away. And we try to be real honest with people about that because we don't want anyone to come to class and think that if I just practice X number of hours before this baby is born, it's going to be a rose garden, because labor is painful, and people need to know that. But the pain is less when women are doing a specific kind of mind diversion than if they just laid there and thought about it.
Does Lamaze also mean medication-free labor?
No, not necessarily. We'd prefer to call it prepared childbirth or educated childbirth. There are medications and anesthetics that are available to women, and we encourage people to be flexible and go with what they need for their labor and birth. We don't ever know how big a baby's going to be, or what size pelvis a woman has, how many nights she has gone without sleep before she goes into labor, or how long that labor is going to be. It's probably one of the hardest jobs we have as Lamaze instructors, and also as labor and delivery nurses, is to keep people flexible.
Let's talk about the couples you see. The couples consist of an expectant mother and her labor coach, and it may or may not be the father.
Right.
What sort of concerns do they have coming in to the labor and birth class?
The couples or the support people?
Let's start with the couples first.
The couples coming into classes, first off, have heard various things from friends and neighbors, and so they've got a mixture of ideas about what is going to go on in class, and also what is going to go on in labor. And lots of times people talk about the worst things that happen, and that's what might stick out in their mind. I think we have a lot of nervous folks who come into class. We have many times it's the expectant mom who has brought the support person and said, please come, I need you. And some support people come willingly because they've heard lots of good things, or because they just want to be there. And we have other people who come kind of dragged, and they're not sure that they want to go through the whole delivery. You know, maybe they'll just be there for labor, or maybe they're going to think about switching on and off with somebody else in the family. We find most of the time that after they've gone through the classes that they get hooked into it. And certainly after they go through the labor part, you could hardly get them to leave for the delivery, because that's, you know, like opening your Christmas present. Sure. That's the good part.
How about after the delivery? Do they feel as if it were a positive experience?
I think most of them do, but then again, we have to be realistic about life. Some labors and deliveries are not what one would like in terms of the length of it, maybe the pain that's been experienced, or the outcome. And sometimes it is difficult for the mom or for the support person. So occasionally we have people who are feeling badly about the way things that went. By and large, people are real happy to have been there together.
Do you teach Lamaze?
I teach some of the classes.
Do you ever see the couples after they have gone through this?
Yes, and I used to work in labor and delivery. My last time doing that was this last May, so sometimes I had the couples in labor and delivery as well as seeing them afterwards. Sometimes they come back to class with their babies and talk to the, you know, other class members about what it was like.
Is it usually what they expected? Did they feel they were prepared enough?
I think labor and delivery for a first-time couple is never totally what they expected. Were they prepared enough? Most of them were. Mm-hmm. And especially with that support person there, they feel that, you know, that got them through the part that they found very different from what their dream had been.
But all in all, they did feel that it was a positive experience.
I think most of them do. Again, we wouldn't want to say everyone does, because that's not true.
Yeah. You and Amy are going to demonstrate some Lamaze techniques that you teach in the class and that helps lessen the pain in childbirth. Will you demonstrate some of those for us?
Yes, we do various relaxation techniques and 5 different breathing techniques for the different stages of labor. And we're going to demonstrate a technique that one would use in a very late part of labor, like right before the delivery starts. It's probably the most visual one, and that's why we've chosen it. And we'll simulate a contraction. I'm going to give a signal that Amy is having a contraction. Most contractions last about a minute, so we'll do a 60-second contraction. Amy is going to be finding a focal point to look at, and this is important for women to really concentrate on something else than what else is going on in the room or what's going on inside their uterus. So she's going to find a focal point and be staring at that while she's doing the breathing technique. I'm going to be calling off some 15-second intervals to help her pace herself through the contraction. Contraction begins. A big cleansing breath to help relax. Let it out. 4 he's and a blow. "15 seconds. Good. Relax your shoulders. Concentrate on your focal point. 30 seconds. You're halfway through with this contraction. Your legs relaxed. 45 seconds. Urge to push. Long. A little faster, Amy. Urge passes. Good. Slow down again. Quiet down. Contraction ends. Take a big cleansing breath. And it's all over. Good job.
I'm glad that's over. Okay, you have another technique, and what is this for? What does this help do?
We thought we would briefly describe one of the several relaxation techniques that we teach to couples. Relaxation is real important in labor, and what we do is a simulated contraction in that we would have a woman contracting an extremity while she relaxed the rest of her body, and her partner would check then to see how well she was relaxed. Amy, why don't you pick out your focal point again? I think you were using the flowers there. And relax your body. Contract your left arm. Make a fist. And she's going to now pretend that that's her uterus contracting and doing its work, and she's going to think about the rest of her body relaxing, while her partner then would check to see if she's relaxed. Your arm weighs 300 pounds. Just let it drop. Okay. And then check each leg. Might help with stroking, touching, massaging, checking her body parts to see how well she was relaxing, reminding her to keep concentrating on her focal point. Relax your left arm.
Now you're playing the part of the labor coach, right?
Right.
And relaxation is a very important part of Lamaze too?
Oh, definitely, because when someone is tense, they're tense in all their muscles, or maybe their neck or their legs or something, and those tense muscles take oxygen. The uterus is also a muscle, and when it's contracting in labor, it needs oxygen in order to do its work. But if the other muscles are tense, they're taking up the oxygen that the uterus could and should be using, and therefore will create some of the pain just from lack of oxygen.
So if you're tense, it's more painful.
Right.
Let's talk about St. Anne's Hospital specifically. We have some slides that you brought, and you might want to guide us through these. The first one we're going to see is of a birthing room, if I'm not mistaken.
I think so. Yes, this is one of 6 birth rooms that we have at St. Anne's. In the birth rooms, women labor, deliver, and spend an hour of recovery in the birth room afterwards with their support person and the baby as well afterwards. Also, other people who have come to wait and see what happens can come in and see the baby.
It looks like a very comfortable room. Doesn't look like your ordinary...
home-like as we can make it. No, we have wallpaper. There are pictures in the rooms. You can see just a little bit of the rocking chair there to make them as comfortable as possible.
What is this room?
This room is part of the Alternative Birth Center. We're seeing one end of it, which you see there has a sofa, which is a sofa bed. In the Alternative Birth Center, people often have friends and other relatives there during the labor and birth, and the sofa bed they use to sleep on when they get tired and want to just have a nap.
Is there a limit on how many people you can have in a room?
No, we don't limit the number of people in the Alternative Birth Center. This is the other part of the Alternative Birth Center. That's a double bed. You can see the cradle for the baby. The couples themselves limit how many people come, and sometimes they'll have a friend or two or another family member, and then later on, maybe after the baby's born, other people might come and visit them.
What is this?
This is a sibling class. We have sibling preparation classes to introduce to the older child what a baby's really like. They often think that the baby's going to play football with them as soon as they get home, and we try to show them that that's not true. They bring their teddy bear or doll and learn how to diaper the baby. They see a film on what a new baby's like. You can see the enthrallment here with what's going on. They also go up to the nursery and look at a number of babies so that they can see how little they really are, and that they cry and don't do a lot else but eat and sleep and cry for a while.
That's a nice program.
Here we see siblings, and this is in the Alternative Birth Center, so we've got a family here with the new baby. The Alternative Birth Center is a 24-hour stay room, and as we've said before, the couple can choose to have whomever they want witness the birth or come just after the birth if they'd like.
This is quite a difference from the way it used to be.
It's more home-like, we hope. And here's a mom in a birth room. You can see that the bed adjusts to her comfort level, and she's going through labor. And here's her support person, the new baby. And they'll be spending some bonding time together. This is a grandparent with a new baby. We have grandparent visitation, you might call it, but grandparents are welcome to come from 10 a.m. to 10 p.m. and be with the mom and support person and new baby, their new grandchild.
Mm-hmm.
Here's a couple enjoying a candlelight dinner the night before they're going to be going back to their hectic life at home. They go down to our dining room so that they're away from the room even and have a quiet time together.
There's a special dinner in their honor then.
Right. This slide depicts the St. Anne's KISS car seat program. KISS stands for Kids in Safe Seats. And it is a state law that infants under 40 pounds or 4 years of age be restrained. So we like to help out by having a loaner program, and for a nominal rental fee, couples can take their babies home in a St. Anne's car seat.
Let's talk about St. Anne's and its uniqueness. I know a lot of hospitals now have birth rooms, but how is St. Anne's different?
I think one of the ways we're different is that almost all of our births are done in birth rooms. The other hospitals might have a couple, but we do all of our normal labors and deliveries in birth rooms. We were the first hospital to allow fathers in the delivery room, so we're an innovative hospital in that regard.
Mm-hmm. How long ago was that?
I'm not sure when it was, in the 60s sometime, but I'm not sure when.
Earlier than I expected.
Probably.
Let's talk about siblings in the birth room. Does everyone want their children to see the birth of a new baby?
No, not everyone does. And this is one other way St. Anne's is unique, because we do have the only alternative birth center in the city that and an alternative birth center that allows siblings to view the birth. This is entirely up to the couple, whether they want their older child there or not. And some people want to use the alternative birth center just so that they can have their older child there afterwards, but they choose when that is.
Do children need to be prepared and educated before they step into that situation?
If they're going to be using the alternative birth center and the sibling is going to be present for the birth, they must attend a special sibling preparation program, not like we saw in the slides here, which is for anyone who has older children, but one that is specifically done with one of the labor and delivery nurses, where they learn what birth is like and what mom's possibly going to be like during the birth.
Mm-hmm. Is the doctor in the room the whole time, or are there other people that help with the labor and delivery?
No, the doctor's not in the room the whole time. Labor can take a very long time. women are typically with us about 4 to 8 hours for labor, and the labor nurse, somebody like Amy and one of the many other nurses that we have, will be with them during the labor. We also have residents in the hospital that if an emergency comes up right away, the resident will come up and assess the situation, and either the nurse or the resident would then be in touch with the doctor. The doctor may be in if he has another patient in labor, or if his office is attached to the hospital and he comes over from office hours to see what's going on with mom. But by and large, the doctor is there during the delivery portion and not for much of the labor.
Okay. Amy, what are your responsibilities as a labor nurse?
We do the exams on the patients and monitor their progress in labor. We go as the liaison between the patient and her doctor, because many times they are not at the hospital, so we call them for pain medication orders, to let them know on the patient's progress, to let them know if there are any problems or just how the patient's doing.
I bet you're there to answer a lot of questions for the couple who are going through this for the first time.
Mm-hmm. Yeah, we always, when they are checked into a birthing room, we explain the layout of the room, where their call light, what the monitor is, what our routine is as far as examinations and checking the baby's heartbeat and that sort of thing.
Are you assigned to a specific mother, or do you have 2 or 3 that you look after during a period of time?
It mostly depends on how busy we are that day. We try and keep it on a one-on-one type relationship, one nurse to one patient. But if we are very busy, then sometimes we'll have 2 or 3 mothers to take care of.
With all the controls relaxed now and people are pretty much on their own, is it still safe to have a baby?
Oh, it's definitely safe, and I don't think people are on their own. They certainly have the support of their physician and of the nurses, and we try to work together to get the best outcome for everybody. But our biggest concern is the health of the baby and the comfort of the mom, and we'll arrive at that by some means.
As we wrap this up, I'd like to ask you, at what point during pregnancy should a couple decide what they want?
We hope throughout they'll be making choices. Call the hospital for the options that are available. Sign up for classes by the 5th month of pregnancy, and for the birth center by their 8th month of pregnancy.
Thank you both for being with me, and thank you for joining us. I hope if you're an expectant mother, you've learned something, and if you're not, maybe this is information you can pass along. Thanks for being with us.
us on Praise the Lord, Hal Lindsey, Hot Gospel State of Mind, and Ron Dryden. And ready to take your call. Some of the most beautiful prayer partners in the world. Now your hosts, Preston and Thomas of the Trinity Broadcasting Network, Paul and Jane Cloud.
Welcome, welcome, everybody. It's time to praise the Lord. Join us right now as we give the winds a mighty